Hi everyone, welcome back to my YouTube channel. Today's video is about the CMS proposed rule for fiscal year 2024 hospice payment rate update. Let's get started. On March 31st, 2023, the Centers for Medicare and Medicaid Services or CMS issued a proposed rule that would update Medicare hospice payments and the aggregate cap amount for fiscal year 2024 in accordance with existing statutory and regulatory requirements. This rule includes information on hospice utilization trends and solicits comments regarding information related to the provision of higher levels of hospice care, spending patterns for non-hospice services provided during the election of the hospice benefit, ownership transparency, equipping patients and caregivers with information to inform hospice election decision-making selection, and ways to examine health equity under the hospice benefit. This rule also proposes conforming regulations text changes related to the expiration of the COVID-19 public health emergency. This rule proposes to codify the Hospice Quality Reporting Program or HQRP data submission threshold policy that was adopted in the fiscal year 2016 Hospice Final Rule at Part 418, Section 312. The rule discusses the hospice outcomes and patient evaluation or HOPE tool, provides an update on future quality measures development and health equity efforts, and provides updates on the consumer assessment of healthcare providers and systems hospice survey mode experiment. This rule also proposes that physicians who order or certify hospice services for Medicare beneficiaries must be enrolled in Medicare or validly opted out as a prerequisite for payment for the hospice period of care in question. CMS is looking closely at the hospice industry as they have increasing concerns about fraud, waste, and abuse in this space. While this rule takes initial steps, this is part of a larger effort by CMS to address hospice fraud, waste, and abuse that will continue this year. Finally, this rule discusses updates on the Consolidated Appropriations Act of 2021 Hospice Special Focus Program or SFP. Medicare hospice payment policies. This proposed rule includes data analysis on historical hospice utilization trends, including data on the number of beneficiaries using the hospice benefit, live discharges, reported diagnoses on hospice claims, Medicare hospice spending, and Medicare Parts A, B, and D non-hospice spending during a hospice election. In this rule, CMS also solicits comments from the public, including hospice providers, beneficiaries, and patient advocates related to increasing access to higher levels of hospice care. CMS also solicits comments on their analysis of utilization and spending patterns, including non-hospice spending during a hospice election, ownership transparency, equipping patients and caregivers with information to inform hospice selection, as well as information examining health equity under the hospice benefit. Additionally, CMS is proposing regulations text changes related to the provision of telehealth services for routine home care at the expiration of the COVID-19 public health emergency and for the use of telecommunications technology for the face-to-face encounter conducted by a hospice physician or hospice nurse practitioner for the sole purpose of hospice recertification through December 31st, 2024. Fiscal year 2024 routine annual rate setting changes. The fiscal year 2024 hospice payment update percentage is 2.8%, which is an estimated increase of $720 million in payments from fiscal year 2023. This is a result of the 3% market basket percentage increase reduced by a 0.2 percentage point productivity adjustment. Section 1814I5AI of the Act was amended by Section 407B of Division CC Title 4 of the Consolidated Appropriations Act of 2021 to change the payment deduction for failing to meet hospice quality reporting requirements from 2 to 4 percentage points. Therefore, beginning in fiscal year 2024 and for each subsequent year, hospices that fail to meet quality reporting requirements receive a 4 percentage point reduction to the annual hospice payment update percentage increase for the year. The proposed fiscal year 2024 rates for hospices that do not submit the required quality data would be updated by the proposed fiscal year 2024 hospice payment update percentage of 2.8% minus 4 percentage points, which results in a minus 1.2% update. The hospice payment update includes a statutory aggregate cap that limits the overall payments per patient that is made to a hospice annually. The proposed hospice cap amount for the fiscal year is $33,396.55, which is equal to the fiscal year 2023 cap amount $32,486.92, updated by the proposed fiscal year 2024 hospice payment update percentage of 2.8%. Hospice Quality Reporting Program. CMS proposes to codify the Hospital Quality Reporting Program Data Completion Threshold Policy at Part 418, Section 312. CMS also provides several updates on initiatives relative to the development of a patient assessment instrument titled Hospice Outcomes and Patient Evaluation, or HOPE, and future quality measures. CMS provides an update on health equity related to HQRP, or Health Quality Reporting Program, and efforts to develop health equity. The proposed rule can be viewed at the Federal Register at the link which you are seeing on this slide. This link is also available in the description box down below.
This is it for today. Thank you for joining me. If you found this information useful, please consider subscribing to my channel and leave me a few comments. Hope to see you next time. Bye now.